Okay, welcome, welcome. Can our participants hear and see now? I see Julie. That's one successful admittance. Justin. We can wait another minute, but I did drop in the chat up above the questionnaire that VRPS sent out recently, trying to get a pulse on the mental health of our profession. So I thought I'd give that a little plug for those who didn't see it. It's open for another week or two. But my name is Michelle. I'm the Health and Wellness Resource Group chair this year, and we are excited to have visitors with us today. And they are going to be presenting on health equity with a community health assessment from Sentara and the Blue Ridge Health District. Jen, Sandra, and Tameka will be able to give us their take on their approach and have plenty of time for questions at the end. And we'll be sure to record this so that everyone who wasn't able to make it today can watch it back later. So if no one has any questions before we get started, Julie does.
I
Yeah.
have a question. Am I able
Mhm.
to share this invite with someone? Is it too late with the fancy registration system? Or
Oh, no, I think you still
can I
can.
send just the link? Okay, thank you.
Mm-hmm. The more the merrier. And then I'll share the recording as well. But when Jennifer, if you're the one sharing your screen, would like to introduce yourselves first or share first, I'll let you guys take it away.
Thanks, Michelle, and good afternoon, everyone. I'm Jen Fleisher. As Michelle said, I'm from the Blue Ridge Health District. We are covering a 280-mile radius of service in 6 counties and the city of Charlottesville. And I'm joined by Sandra, if you want to introduce yourself.
Yeah, hello everyone. I'm Sandra McMasters. I'm a community benefit project manager for Sentara Health. I actually help all 12 of our hospitals in Virginia and North Carolina to complete their community health needs assessments every 3 years. And then I'll have Tameka introduce herself.
Thank you. Sorry, my camera and lighting is horrible, so I'm going to work on that. But my name is Tameka Irving. I'm the Community Benefits Manager for Sentara Martha Jefferson Hospital, and I also work on the Community Health Needs Assessment.
Thanks. So the three of us together partner to do this community health needs assessment, and I'm about to share my screen with you all so that you can we can kind of go over what a CHINA, as we call it, is and how it works within your communities. And then we'll be open for question and answer after we go through this to help you kind of navigate a CHINA process. So it stands for a Community Health Needs Assessment, and it is an overall collaboration between Sentara, Martha Jefferson Hospital is our health district's local hospital, the Blue Ridge Health District, and UVA Health. So the nuts and bolts of a CHINA are all nonprofit hospitals are required to do one by the ACA, and every 3 years is the mandated time period which they must produce a CHINA report. The best practices for that 18-month long assessment are to involve community members, hospital systems, and the health districts. VDH is 35 health districts in the state, to identify needs, gaps, assets, and resources within the community to improve health. And as of late, most of that health improvement is around health equity and reducing health disparities. So this is not only a mandated process for Sentara, for example, as a nonprofit hospital system, but one that the health systems collaborating is really the backbone of the process. So whereas it's not mandated for UVA or the health district to do a CHINA, we always participate because we should, and we want to know those gaps and needs and assets as well. And we work better collaboratively as we're serving the same footprint of patients and community members. So there's different ways to go about a CHINA. We choose mobilizing for action through planning and partnerships, a MAP, and locally in the Blue Ridge Health District, that's called a MAP to Health. So other options are a community commons has a community health needs assessment tool. There's the ACHI community health toolkit. The county health rankings, which is out of the Robert Wood Johnson Foundation, has a handbook for running community assessments. And then out of Kansas is the community toolbox. So we'll share the links with these slides with Michelle to circulate through this group, but Map to Health is just one of the ways to do a CHINA that our health district has been doing since 2009, I think is the first CHINA we did all together with Sentara. If it's not a collaborative process with your health systems, which does happen, sometimes the nonprofit hospitals will just do their own CHINA without that collaborative piece. Lots of reasons why that can happen, many times being resources and capacity of the other partners. Then it's often a published report through that health system itself. So through that private partnership. And they can use a toolkit that meets their needs. And at any time, if you have a question, I will try and monitor the chat, throw it in there, or just holler Jen, and I'll stop and answer your question. So again, I mentioned that the focus of CHINA, particularly in the Map to Health framework, is to reduce health disparities. And just to give you our definition of health disparities, it's differences between groups in health and health care that stem from broader inequities, predominantly systemic racism, poverty. So those inequities at that systemic level are what a Map to Health or MAP framework or any CHINA are really taking a glance at. And in a MAP in particular, the components to achieve health equity work not only as a goal, so the goal is to achieve more health equity once you have done your health needs assessment and are starting to work on implementation plans, but it's embedded into the process. So there's whole community partnerships, there's a lot of community voice in decision making, and then there's a lot of mobilizing for that implementation to reach that health equity status. And that's really the elimination of those disparities at the highest level for health. So it sounds lofty. I mean, you're not going to dismantle systemic racism with 1 3-year cycle of a map, but that is always the goal that we're leaning towards and embedding within the process. So it's made up of 4 stakeholder groups, I'll call them. There's a core group that runs the Map to Health process. That's one member at least from each health system, in our case, Sentara, UVA, and BRHD. And then they do the data gathering, the kind of project management of the process, and they maintain the overall communication and facilitation between other partners. Those other partners include a steering committee, and this is a new committee for the MAP process, which has just been revised this year. So that steering committee is about 10 to 12 people, can be up to 20 people. And that steering committee helps make decisions and input that feed back to the core group for them to implement throughout the MAP process and in the end, in the implementation process. The steering committee can be community members, but they're often folks with time, capacity, and resources to contribute towards the MAP. And in the end, again, to this implementation initiative end goal. Then the community gets involved. So there are surveys conducted. This year, we're doing a door-to-door survey as well as focus groups. And then there are in-person surveys that happen during, say, events that our health workers and health teams attend. And then there's stakeholders. That's more traditional, kind of your role as organization leads and lead partners. We do a stakeholder survey online to kind of gather your input as to how you are serving your clients or patients or community, and what your needs and gaps are as well. So you get this on the ground end user perspective, you get a collective perspective in the focus groups, and then you get kind of the content expert perspective in the stakeholder survey. And in the end, you combine all of that information to come out with your priorities. So every MAP cycle, every 3-year cycle, determines what the priorities for the next 3 years of the implementation plan will be. What is your community going to work on? What should grants fund in order to move the needle and reduce health disparities and improve health equity? Here's what everyone said it should be. So that is a process that looks at qualitative and quantitative data. Then it looks at all of the surveys which are providing that data and really analyzes and evaluates that information usually with a data team or a data lead, and then also with that input from the core group and the steering committee, and then comes out with these 4 priorities. Generally speaking, it's 4. In MAP, that's kind of what they lean into, to say these are the overall topics that for the next 3 years we should be looking at providing programs, providing grants to amplify and, really lead in the community under these topics. And then all of that is produced into a report, which is launched on that 3rd year of the previous cycle or that 1st year of the new cycle. So in the slide you're looking at, that is the cover of the report from 2022. And we will publish again in the fall of 2025. For example, here's the 4 priorities we're working on now. So once the report's published, so once the CHINA is complete, you've gathered your working groups, your core group, your steering committee, your stakeholders, you've surveyed everyone, you've looked at the data from the census, you've looked at quantitative data from county health rankings and from University of Wisconsin, and you've looked at the, what are the bare bones metrics you like to look at. For sometimes that's life expectancy or what maternal health rates look like. Sometimes that's now more often than not partnered with what are your poverty rates in your footprint, what are your rates of what's called the deprivation index or the community resilience, what indicators on those charts are flags in your community. And then you pair it with that qualitative data, the surveys, the interviewing, the stakeholder groups, and you came up with these 4 priorities. So we did transportation, the healthcare workforce, digital access and skills, and then mental and behavioral health. Now, certainly a health system is not responsible for transportation in a health district, right? We don't run the transit service. We don't own an Uber, but we recognized in all of the surveying that we did in 2022, transportation is a key tool and a key indicator of how healthy you are. Not only getting to health appointments, certainly that's one of the things we're really looking at, but can you access transportation to get your basic needs done? Can you access transportation for school and particularly if you have a mobility issue? And we realized how integrated transportation was to health overall for our community members. So we partner with the transit providers and we provide them with, hey, here's these initiatives we'd like to move the needle on that would improve our patients, our community members' health. And can you work with us to implement these? Are these already in the works? How can we partner with you to, again, amplify the work you're doing that may help this? So, for example, one of the leading initiatives that came out of transportation as a priority, or what we call a policy target, was getting discharged from the ED, getting a ride home, and how difficult that was for folks in our district. Again, with Charlottesville as the urban center and Albemarle County as our kind of next urban ring, the rest of our district is very rural. And that rural kind of spacing out of housing and resources increases as the circumference from the urban center broadens. So we really recognize that folks that were living way out in Nelson County, which is which is south of the center of Charlottesville and quite rural, were really having a hard time getting home from doctor's appointments, from even making doctor's appointments, and didn't have internet to do a telehealth. So then we were like, oh, okay, digital access and skills are an area where we really need to work. Again, we're not setting up phone lines. We're not creating high-speed broadband, but can we train community health workers to be digital navigators. So when that older adult that you love and adore calls you to ask you how to use the photos on her phone for the 50th time, is there someone else that can help them navigate that? And even more importantly, can they sit and help them navigate a telehealth appointment or provide them with a hotspot and broadband to do that? So one of our initiatives with the health workers from the health systems was, let's learn how to be digital navigators, improving skills. And can we advocate for broadband? Can we attend legislative sessions that pitch broadband and say, yes, us too, we think broadband is needed in these areas because our patients can't get the healthcare they need because they don't have service. Healthcare workforce and mental and behavioral health are very intertwined from our priorities last time, and really have to do with diversifying the healthcare workforce. So those are really about expanding the pipeline of healthcare workers. As you may notice, we are very low on staffing healthcare, particularly mental health care, and in broadening that pipeline, getting everything from kids in high school interested in clinical careers to peer recovery specialists to be embedded into health systems. So those are people with lived experiences in the behavioral health field in either substance use or mental health, and they become peer navigators and support for patients, and they have great outcomes clinically speaking. And can we get more of those into the system? So that's just a glance at how the CHINA works on the ground. It's not really just about that report. It's about moving that through into implementation. Okay, you're almost done with me. This is how we're going this year. We're doing our implementation plan, and the outcomes of our assessment will be based on the Chicago 25 model. This is a model that has different layers of intersecting with their priorities. So in Chicago, they have one theme that's their priority, and then they have policy targets. So they have 6 policy targets, from public safety to public health systems and housing. So we intend to come across, again, our 4 main policy targets. Then they're focusing on or targeting particular populations in those policy targets to move the needle with. So they really want to work on Black and Latinx and low-income Chicagoans in both health and human services and food access. And so they'll know they're being successful if those populations advance their health in those areas. They have a goal for each of those policy targets, and then an overarching vision for all Chicagoans that they are free from oppression and strengthened by equitable access and resources, and they have opportunities for optimal health. So again, gets a little lofty when you look at the vision, but that's what a vision should be. It's the genie lamp. I envision a world where everyone has everything they need to be healthy. That's a perfectly fine vision. And then it breaks down into that more granular level of how we can actually do the work. Again, you only have 3 years to do the work as far as a CHIN is concerned. And all of you, I think, work in some sort of bureaucratic agency, which, it's very difficult to move the needle in 3 years. So this year in particular, we're really honing down to very specific populations, very, very tight geographical areas, to say, we're going to do an implementation that works in this area for these folks and on this one thing, and see if we can move the needle there. Because, one of the problems of doing the CHINA is that it's really hard to prove that you're having success at it. They can be so broad. Last but not least, your role in this process is you may be invited to, for example, in our district, answer the stakeholder survey, or participate in a focus group if you live in a particular neighborhood that we're looking at, or you are part of a particular population of folks that we want to know their opinion, veterans, for example. So if you get that shout out from your health system or your CHINA, or in our case, your MAP coordinators, to say, hey, we've got this survey, we'd love to know, the best thing you can do is reply to that email and join that focus group or answer that survey, because that data is going to help really define those priorities and then ultimately work on those steps that will implement health equity and decrease health disparities. So you may get asked to do even further things, join a steering committee, or be one of those committee members that moves forward. I know bandwidth is limited, but if you want to be part of that decision making, and that would move both your initiatives and your organization's initiatives forwards, that's a great place to go. We definitely include Parks and Rec in our ask, as well as legislative folks, city administrators, environmental administrators. It's not just agencies and organizations and nonprofits that work with health. It's kind of that broader social sphere that we look at. So I'm going to stop sharing. And then I don't see anything in the chat as of yet, but I'm happy to answer any questions you may have about that process, ACHINA, or its implementation. Or not. Okay.
I do have a quick question. So we have a health collaborative here in Danville, and they did all of our health equity report already. But what we have noticed, we just had a meeting or a summit yesterday, and what we've noticed though is that our health workers are our grant is ending for them. Are you guys having that same issue with funding for them? Because I know they really help bridge that gap, and they also refer to our services as well, just like you said, for mental health things or socially. But if we're losing them, I just was wondering how you guys are meeting that need there in your community.
Yeah, that the change in that for a lot of that funding is really devastating. It's community health workers. We agree with you, Rena, that they are the key to moving the needle on. I'm sorry, I keep saying that term, but they really are the ones who are making the work happen. In our district, we reallocated funding to keep our community health workers, and there is a movement at the General Assembly level to re-up their funding overall. So we in particular were able to secure our health workers for another cycle. If they had pulled that funding and we could not piece that together, we would have sought that funding from private donors, because we were really committed to keeping them on board. So to kind of encourage that, we have started and this actually came out of the last map. We started an outreach network and a community health, which includes community health workers. And that network is so big and broad now, the kind of collective voice to stand together and say, we're doing all this work, we've got metrics that prove it, and we're a group of all kinds of outreach workers, has been helpful in saying to donors and to kind of legislative officials, hey, this is important work that goes beyond health systems. It moves into many organizations, and it's worth funding. They also get a lot of workforce training from being part of the system and that network, and a lot of like interagency support. So I think the short answer is we got lucky and we got to find the funding, but if it wasn't there, we were going to hit the ground and figure out how to fund them anyway. Does that help? Is that answering your question?
Yes.
Okay.
Yeah, it does. Thank you.
Yeah, sorry. Justin, I see your hand up.
Thank you, Jen. Good afternoon. I want to thank Jen, Sandra, Tameka, everyone involved for your time. Justin Bullock, Director, Greene County Parks and Recreation. Not necessarily a question, but just wanted to give a comment to my colleagues on this call. Certainly want to encourage everyone to investigate and see if these type of opportunities are available in your local community. Some of the data that's being shared, it's truly beneficial to your efforts, whether that be through your program creation, whether that be with projects or things that you're looking to do. In Greene County specifically, we've used much of the data gathered from Map to Health to support us in some different opportunities grant-wise, to be able to allow us to provide that beneficial numbers that are needed to be able to share with the ongoing needs within our communities. For example, we got some funding to support us with an outdoor Rec to Go program. We call it GCPR on the go, where we're able to take our services on the road, bring them into the communities around the county. We use a lot of those transportation disparities to be able to share that was found in that Map to Health study. We used it for some other support that we've been able to receive to work on an outdoor fitness area for folks to just continue improving their health and wellness. And so I found nothing but benefits from it. And I've shared the final report in the chat for everyone to take a look at. And so I really just encourage you to see if you can be a part of it, how you can be a part of that change and just continue improving your communities for the better. Again, I want to thank you ladies, and that's all I've got. Thank you.
Thanks, Justin. That's great. And it's great. Right now, green is actually, you'll be hearing more from me in particular, Justin, because we're having one of our on the ground door-to-door surveys is going to happen in green. And that's kind of a new approach just because it's so hard to do door-to-door surveys, and, you know, COVID kind of derailed any of that effort this summer. So really hoping to get a really deep granular understanding of what folks need to be healthy. And you can always reach out to, so Justin can reach out to me at the health department and say, hey, Jen, I need some data on like mobility and who has access to transportation, because I want to set up a service to get people to our parks and to Greene County has a great kind of market pavilion area that's right down in Standardsville. So my team has that data for you, and we can share that with you. And as we gather more, continue on in supporting you in your grant efforts. And then when the report comes out, Sandra listed the link in the chat for Sentara. They put all the granular deep dive kind of appendices on their site. And we have some of the, you know, not the hundreds and hundreds of pages, but like, you know, certainly we have a lot of data that come out in the report itself. That being said, we're happy to help get you any information you need. So reach out to your local population health team at your health district that you're in and say, hey, do you guys have any data that you're looking at with your, it's often called a CHA in health districts instead of a CHINA. It's the same thing, community health assessment. And they can help with some of that work even before you see the next report. But they will have access to past reports and the one that is most current. So thanks for the shout out, Justin. It is a great effort, I think, and it ends up being a tool instead of just kind of a document that gets thrown in your recycling bin, I hope. So that's great. Other questions or thoughts about your work and how that overlaps, or how you might connect to a CHINA?
I have another question. You shared briefly on some of the ways that we can support, but are there any firsthand examples or scenarios that you can share how Parks and Recreation departments have been supportive in maybe the development of this manual?
Absolutely. It's a great question. So in the 2022 process, we did that a little bit differently. Again, we try, because Blue Ridge has been part of this process since 2009, and that's unusual for the health districts. We now are getting into like, let's be innovative and try something new. In 2022, we did the process a little differently and had a leadership and a locality council versus a steering committee. And in the leadership council were elected officials and government agencies. And so we pulled in Parks and Rec at that point from as many, I think all the localities participated in some format, but kind of led that as a focus group. And so then when we came to the priorities of transportation, we embedded trails, mobility, bike ped, green space, and access into transportation. And so those initiatives and goals, though they're not about transit and they're not about, you know, improving the transit system, they are an integral part to getting around. And so that getting around was how folks improve their health and get to their health appointments. And so Parks and Rec had a great overlap and actually input there and said, hey, look, for example, the city of Charlottesville, we only have at that point, you know, 2 folks working on maintenance. We can't contribute to any implementation projects that say work on bridging parks to existing greenways, but we're very interested in supporting that work. And we want to be the end receiver of those folks coming to our parks and going away. So we synced up Parks and Rec to local advocacy groups and nonprofits, and they finished the Greenway, and Parks and Rec advertised it, and they promoted it, and they gave best practices from their expertise to those agencies building the Greenways. So that was just kind of one example of how getting that input of what was needed from this Parks and Rec as they went through those focus groups and then applying it to the priority implementation worked in the real world. Is that what you were thinking, Justin? Does that scenario align with what you were expecting?
Definitely. Just was eager to see kind of ways that our industry can support the efforts and continue getting this valuable information and content out. Like you're saying, whether it's using our spaces or facilities or even the programs that we create. I found nothing but benefits from it, and I would again just encourage everyone on the call to maybe reach out to your local folks. Who exactly would they contact? Would it be the health department? Would it be their local? I know Sentara's, pretty throughout the state, but who would you encourage? Who would be that first person that we reach out to in order to find out if this is something even in our various community?
So, Sandra, do you want to speak up for Sentara?
Yes, I will add that the state luckily is pretty much pushing statewide to be on the either 24 or 25 cycle right now. So everywhere that Sentara is, we're on the 25 cycle. In quite a few of our health districts did a mini survey in 24, and they're going to do another one in 25 to also align with Sentara and some of our other community partners. So we're all in the process right now of either completing or starting to complete the next round. So just keeping that in mind. Some health districts are not doing a community health survey or an assessment because they're not actually required. The state wants them to, but since they're not officially required, they might not be doing one. So you can reach out to them, but they might not. And then, but all the health systems pretty much, I think almost all of us are either on a 24 or 25 cycle. So we're either completing one now or finalizing one right now. So you can always reach out to the health system or look for your population health manager at the health district that's local. But your health system's probably, if you can find someone, like I would be your contact for Sentara. I'm doing all the collaboratives right now throughout the state as well as in North Carolina. I would also like to add that in North Carolina, we did have a point where Sentara, we do provide grants, and we have provided grants to Parks and Recs in the past. At one point in time, we found it challenging to really justify funding Parks and Recs. And so in 2021 and 22, North Carolina Parks and Recs came to our hospital there and wanted to do a focus group and explain to us what they needed, why they needed it. And our leaders were able to take that back, and we were able to start funding some of their projects in their communities. So that's another reason to be involved in this process with your health system, so you can voice your concerns, justify what's needed, and try to really advocate for those grant funds too. And I know that was a lot of information, but
Oh, that's great. So Justin, you're looking at Sentara, look for Sandra. And if you're in Charlottesville or in the Blue Ridge Health District, you can reach out to me or Tameka. We're all working on it. And outside of Blue Ridge Health District, again, touch base with Sandra. She'll connect you with the lead for the Chinna that's associated most closely to that Sentara that's near you. And if there's not a Sentara in your area, reach out to your health department or your health district and say, hey, I'm looking for your community health assessment or your CHA program or population health officer, and they should be able to sync you up with whomever's doing it there. So, I can't remember the other nonprofit hospitals, but I'm just going to throw out Cigna as not knowing if that's true. But for example, if there was Cigna and they were nonprofit, you could reach out to them and say, hey, you're nonprofit, which means you're doing a Chinna. We'd like to be involved. And that grant piece is really key because the Sentara Cares Grant are really aligned with what has come out with CHAS over the years. So the categories you can apply for, you can usually fit into one of those categories and align with what is happening with the Chinna or that implementation plan. And it can really make programs happen. So certainly you guys work a lot with schools and the school system. And we have a lot of school program leads that look to grants to support their internal programs or ones that collaborate with other organizations like Parks and Rec. So it's definitely, she's right. It's definitely great to stay in touch with for that, because it's not only a generous system, those grants are generously given and they are given broadly, but they don't, look for Sentara Cares grant. And when thank you, Sandra, she's put the apply for the grant note in. We just closed one cycle. So there'll be the fall cycle will be opening. And there's really a lot of opportunity there to kind of move forward your programs, particularly if you're like, hey, I saw this in the map to health, mobility and transportation is an issue. We want to do a program for older adults at our downtown parks. We're going for a grant. That is not a far reach, and it really sinks into what Sentara is standing for. The health districts themselves don't give the grants, though, just to be clear. Like, we help facilitate, but the grants all come from either the health systems and in this case, Sentara. Cool. What else? All right. Hearing nothing, Michelle, I'll punt it back to you, but thank you all so much for hearing us out, and we'll make sure to get that slide deck circulated. And I'm just going to put in the chat now my email to make communication a little easier, but that will be included in whatever Michelle circulates. And again, there's some grants to grab from the chat, but yeah, thank you so much for having us, Michelle.
Yeah, you're welcome. Thank you guys so much for coming on. We appreciate all the tidbits, and hopefully partnerships can grow from here.
Perfect.
So I don't have anything else planned for the meeting formally, unless there are any roundtable topics that people are interested in bringing up. If you've got questions, we can plan another one of these meetings if you want to think about those in advance a little bit farther out. We could do that in June. If anyone's got any budget drama going on in their department, I could share that. Unfortunately, I'm with Arlington County, and they decided to cut the personal training program. So that's been a hard pill to swallow, laying off employees and everything, the full gamut. So if anyone has a Parks and Rec department without personal training, I'd love to pick your brain, but we're supposed to do more group training because we can spread our reach further. I know fitness professionals can appreciate the individualized attention that people can get from the one-on-one, whether they just need the reliable person to show up with or tailored programming for their health needs. We can reduce insurance costs and all sorts of things. We know the pros and cons, but we'll work with what we've got and see where it takes us. Raina, I see that you guys don't have personal training, so thanks for sharing that. But yeah, if anyone doesn't have any other questions, comments on this or other things.
Michelle, if I can, I just had a couple quick comments.
Yeah.
Again, I just want to thank our friends from Sentara for joining on this call. I really appreciate that. On this call, we have folks, and I'm going to be overlooking some because I don't know every name, but I know we've got Corey, who's from City Harrisonburg, Melissa's in Suffolk, Virginia, Raina's in Danville, Michelle's in Arlington. So we have a wide gamut. Oakton, Virginia, Oakmont Rec Center, fitness director. So we have some folks from throughout the Commonwealth. And so I just appreciate you all's time and sharing the projects that you all are working on. Just a couple quick comments. Julia put it in the chat, but we are approaching the deadlines for the annual conference for this September in Norfolk. Award submissions are due, I believe, May the 6th, I want to say. Don't hold me to it. You can check the VRPS website. But if you're doing some cool things, if you want to be recognized as being a state leader, certainly apply, submit that. I highly encourage you. May 15th is that deadline for educational sessions. We've been talking about it. We wanted to continue to bring health and wellness to the forefront and some of the things that are going on. We issued the challenge to our members to try to be active and be a part of that process. Share whether it was anything that you're doing within your community, different collaborative programs that you've been able to put forth. But please just if you are willing and want to serve as a speaker at that upcoming conference, I would just encourage you to put your best foot forward, submit that, and try. And then finally, we are getting ready for the second VRPS newsletter, the VRPS magazine of this 2024 year. And so if there are any other awesome things that are going on within your communities, Rebecca down with the City of Hopewell is a contact. I will see if I can get her email really quick and throw it in the chat. But May 5th is that deadline to submit that content to her as well. Thank you so much.
Well, thank you all. Those of you that are on here obviously figured out how to join. But if you registered for it the way that I did it this time, it went on your calendar. But if we do it like this again, I can put a reminder to register for it to auto-populate on your calendar. We've been alternating Wednesday afternoons and Thursday mornings, so more people who have set schedules can fit it in. But I will send out the recording, and I thank you all for tuning in today. Have a great spring.
Thank you.
You're welcome.
Nice
Thanks,
job.
guys.
Thank you.
I don't think there are specific categories. They do break it down sometimes via the area that you're in or the community you're representing, but no specific areas. They're always searching for content. So if it's something that you'd like to share, they will not turn it down. They'll find a way to recognize you and celebrate what it is that you're doing.
Okay, that's awesome. I run the teen center in the town of Vienna, and we're celebrating 25 years of the teen center with a through a teen wellness festival, and we incorporated a spirit week mixed with our 10-year anniversary for Club Phoenix awards. So I just wanted to get a feeler for what type of articles you guys are looking out for. So that's awesome.
Yeah, that'd be fantastic. I mean, to celebrate a silver anniversary like that, that's something to definitely be celebrated. And so I put Rebecca's email in the chat. You can contact her, maybe share some of your thoughts on what you would like to include, and I'm sure she could give you a little more defined direction or answer any specific questions that you may have. But I know that they would be more than happy to share what's going on in Vienna and help to recognize your what you're doing.
Awesome. Thank you so much.
You're welcome. Michelle, thank you so much. You did an awesome job.
Oh, thank you. Thanks for plugging the extra tidbits that you knew would add the perfect amount.
I try to just help where I can. I think it was a good call. Hopefully folks will be able to take a look at their local area and see if it's something that they can put into the fold. So yeah, good topic. Diverse, kind of a new area. So I think that just helps to kind of sharpen and broaden some of our members who are on these calls.
Right, I agree. It's always an Arlington goal to be more diverse in our planning. So a great tool to be introduced to.
Yes, ma'am. Well, I'll be on the lookout for our next leadership meeting. And I think we already have the next one scheduled as far as the topic and things like that. So excited.
Sounds good. Thank you so much.
You're welcome. You take care.
You too. Bye.
Thanks. Bye.